honored to have a little role in the book written by Ian and Elizabeth Ring Cassidy and so on. Angela. Oh, Angela's the most beautiful woman. And really, it was published by the deVeber Institute on the abortion, complications of abortion. I did part of the coda that talked to psychospiritual pain at the end of life for women who had earlier in life had abortions. And when I saw the suffering that they had at the end of life because of decisions made when they were young, and the amount of pain they had that was not manageable with the usual opioid or tranquilizing agents, they couldn't be managed. And I thought to myself as I worked hard on this, there's something a lot more going on. So I kind of faced some of them with their spiritual pain, which also is covered with palliative care. What is really bugging you? What is hurting you at such a deep level? So there were about 23 cases in my 38 years. But of these, I only documented really 7 or 8 case studies. And the one I'll just mention briefly was a mother of 2, and her husband insisted they could not have a third. It was going to get on his nerves. So he drove her to a place where abortions are done and left her there to get a bus home. Oh. Left her there by herself. So she's looking at me and saying, Jean, I'll never get to heaven. I won't get to know God's heaven because I've killed my baby. Heart-wrenching. We were able to talk about forgiveness, about love, and all I could say to her was, remember the cross. Remember the Christ. There is forgiveness. There is love. And I sat with her till 2 o'clock in the morning. Do you know what? Her requirement for medication for pain went down. Her requirement for anything for anxiety went down as well. It was an enormous and amazing thing for me. So, and her fear at the end of life was that we were somehow going to take her down there to that room and they were going to put her up with her legs up and probe at her. And she looked down at herself. Am I bleeding? Am I bleeding? No, you're not. We're going to keep you comfortable. And I promise I will not leave you. I will stay. That's palliative care. I will not leave you. So, I'll go on. Yes, thank you. So they varied in age from 20 to can I lift this out here and just use it? That's better. From 20 to 90. I had 90-year-olds just as worried about their pain and the psychospiritual aspect of abortion at the end of life. And the great fear that I killed my baby. I've still got some of their little notes that they wrote to their unborn children. And it's heartbreaking. And I always manage to holler for the clergy because sometimes, I mean, as a layperson or a nurse even, I'm not allowed to proselytize. I can't teach what I believe. But when they ask me, I can tell them. Anyway, some were able to achieve spiritual peace before death, others were not. So that's looking at one area. The legal framework The law supports ethics, folks. Unfortunately, where are ethics in the whole thing? The law around euthanasia. The ethics around euthanasia are supporting the law. So in both cases, the law is there. And society supported abortion from an ethical standpoint. The only exceptions, and I have to give credence here, the help I've had with Dr. deVeber, Professor Gentles, people like Alex Schattenberg, it was the Roman Catholic Church, the Right to Life, everybody but my own church, my own congregation, and my own faith system. And that's the Protestant version. I just didn't hear anybody squawking. The pews were silent. I have trouble with that. The pews can't afford to be silent. So in the cases of abortion, the mothers went outside their own moral values and beliefs for convenience because they were encouraged to or sometimes coerced. So now inflicted death today comes along. So we have Bill C-14 that legalizes euthanasia and assisted suicide. And I'm sorry, I have great difficulty with medical assistance in dying. I sort of trip over it. So,
I vomit over it.
Yeah, agreed. So to try and make this less objectionable, we've been through PAD, physician-assisted death. No, that was a little too strong. We'll go to MAD, MAD, medical aid in dying. Oh, no, we need something less offensive. That sounds like MAD, MAD. No, we can't have anybody mad. Okay, so we'll go to MAID. That'll keep everybody happy. Medical assistance in dying. Ooh. And so doctors and nurses are, as Kathy was saying, are responsible to carry out the whole procedure. The orders to provide, the person must be 18 or older and must have an irreversible and irremediable medical condition, such as ALS. They use that all the time, if you notice. The media drives this like crazy people. They're on top of every sad story of somebody suffering and choking and dying and any bad story they can get their hands on, they're using. So the condition must be intolerable to the patient. Well, who knows what's intolerable? Yes?
Intolerable is subjective, so there's no definite definition.
I'm sorry, I can't hear you.
I'm sorry. Is it intolerable subjective? We can't really define what it is, right?
Intolerable is subjective.
This is my point. It is subjective. How can a doctor measure intolerable?
No, only the
How
person
can-
can tell us.
Yeah, the person who has the disease is the one who can say it's intolerable. But how do you know it's I mean, irrespective of it being intolerable to the person?
Euthanasia on demand.
Well, it is absolutely euthanasia on demand. So you have to do this, and it requires 2 medical doctors or 2 nurse practitioners. I'm glad I'm not a nurse practitioner anymore, let me tell you. I'd be civilly disobedient to the government.
That's what I'd be.
And RNs and RPNs must assist if they're under the direction of a physician or a nurse practitioner. So the ethical dilemmas here, we've got tons of them. The law violates both medical and nursing ethical guidelines. Our ethics in nursing and medicine do not include putting our patients to death. They've always been caring for the person, trying to make them well, trying to give them life to carry on. I cannot imagine taking a needle and putting it in the vein of any one of the thousands of people I've cared for over 36 years of active work at the bedside in palliative care. I could not do it. Yes, I could keep them comfortable. Yes, I had an armamentarium of medications at my disposal to keep people comfortable until the end of life. The other question I have, how do we know that death ends your pain? How do we know? Think about it. Somebody asked me that question. I just sort of looked at them like, what? How do we know death ends our pain?
We have a gracious God.
We have a gracious God. And for those who want medical aid in dying, can we assure them that they are going to have peace and lack of pain when they die, if they are not believers? It's just, all the funny questions that can come up. Anyway, it is that we may have conscientious objection. Okay, as a nurse and a doctor, you can object conscientiously, but you must refer to somebody who will do it. That is complicit in the act. That implies complicity. You don't refer to somebody you don't trust, either as a nurse or a doctor. You're not going to hand your patient off to somebody you don't have faith in. And so it's really, there's no moral or really spiritual values honored for nurses and doctors in this whole thing. Now, I believe too, this is against our Charter of Rights and Freedoms, and I say them to people. We are supposed to have freedom of conscience and religion. We are supposed to have freedom of thought, belief, opinion, expression. Where is that for the doctors and nurses today? It does not exist. The government has successfully decried and obliterated our charter, Canadian Charter of Rights and Freedoms. And I have trouble with that one. That will be the argument, by the way, when it goes to court, which things will go to court very quickly. The opting not to participate could imply civil disobedience, and as I say, I'd be one of the first ones to be civilly disobedient. How will our rights to follow our values and beliefs be protected? So, how will they be protected? We're not protected. I think back on a couple of the patients I helped. Listen, I'll tell you, I cannot tell you the number of people that I was honored to walk with in their walk towards death. That is an honor beyond anything that's really, what shall I say? It's something you never expect to do in your life. And I had a young man, 38 years old, who had cancer of the bowel, and he knew part of it was his problem. He hadn't gone to have polyps removed or even be checked, and the polyps became malignant. And he ended up facing the terminal stage of illness. But did he ever get angry at being called terminal? And I mentioned this in our book, Ian. And that young man said to me, you go out to that chart desk out there and you tell those people, don't you dare label me terminal. I'll tell you when I'm ready to discuss the end of my life. Tell those people, stop labeling me terminal. So actually, he got a pretty good year of doing things he desperately wanted to do for a wife and 3 children under the age of 12. He got some things built in the kitchen because he had good pain management. He actually took it upon himself to go back to his church. And that was amazing. He said, I want my children to know that I'm going to be there when they get to me later on in life. And that somehow or other, they will have a dad they would be proud of, and a granddad they could be proud of. But don't dare label him. We've got to do something about that label terminal. And the media loves that one too, by the way. So support for medical aid in dying has been pushed like crazy by media, politics, and believe it or not, our professional organizations.
Yeah.
This is what blows me out of the water. Now, I've had many a bitter letter, Canadian Nurses Association, the Registered Nurses Association of Ontario. I have not been kind in what I've said about their letting us down at a professional level. And those supporting euthanasia prevention have not been heard. Our Euthanasia Prevention Coalition, nobody wants to pay any attention to us. We're saying no, and they're saying yes. Why is this happening? Well, okay, number one, we've had Hospice Palliative Care in Canada since 1979, even a little bit earlier. We opened the Hospice of Windsor and Essex County, Inc., in the Windsor, Essex area. Do you know who supported us? The wonderful people of Windsor cared enough about their community colleagues that they funded the whole thing. We now get some government funding, and I'll tell you something horrible that's happening. Gaétan Barré in Quebec is telling the hospices, if you don't do the killing, and I'm saying that's not how he's saying it. If you don't do medical aid in dying, you're not going to get you're going to have your funding reduced. I mean, it's bizarre that that's the current status, is threatening. He's threatening them. Now, so there's lack of accessibility. In Windsor, we've got almost 80% coverage now in palliative beds. The rest of Canada, we only have 15, 30% max coverage for our population to access good pain and symptom management at the end of life. Something's wrong, folks. Something's terribly wrong. So there's lack of investment and lack of education. And Kathy, Dr. Paff and I are probably going to have a major whatever at the University of Windsor, getting this included in undergraduate curriculum and medical school curriculum. This has to be taught early. It also has to be taught to people who are out there in the practice area who honestly don't know pain management. I had my family member operated on a couple of weeks ago, and there he was, his spine opened, cage put in. He was in terrible pain through here. And the nurse standing beside him said, I'm sorry, you've got another 20 minutes and 34 seconds and 12 milliseconds before I can give you another. Come on, this is 2016. Don't let people suffer. It's ridiculous. And so we've got to get nurses to listen to what the doctors are writing, and we've got to get the doctors to order in a different way, like every 3 to 4 hours instead of every 4 hours, or whatever the patient is experiencing in pain. Anyway, most practicing medical doctors and nurses just don't know palliative care, And I'm proud to say, and for those of you who visited us, Kathy Matusiak, Pat Delante, is Pat here today?
Not yet, she'll be in the evening.
And Martha Crean came to Windsor when I was doing, launching our book, Ian, and they went and did rounds at the hospice. Not only are there beds for people who are actively dying, there are 47 programs to keep people well during their illness, whether it be cancer, cardiovascular, renal, it doesn't matter. We're open to all. The others, we gotta think about the others affected, and I always think of Mark Pickup, Mark Pickup with multiple sclerosis or MS, and he's been in a wheelchair for 30 years. He thought of dying when he was first diagnosed, and he was so overwhelmed by the horror of the disease and what it did to him that he wanted to die. He said, honestly, if there had been euthanasia, I would have done it. So what happened was, he now has his children, he now has his grandchildren, and he runs them around in a little cart that zips on behind his motorized wheelchair. He wrote a letter to his family doctor saying, if I ever ask you to put me to death, please know that I'm out of my mind. And kindly do not do that to me. So society at large, oh, we've got to worry about this too. Future generations, I look at my little grandchildren and my beautiful granddaughters there are little ones and there are older ones in my group. And I think, what kind of legacy are we leaving them? Canada as a culture of death. Oh, spare us. And the impact of this decision, I've got to go into an acute care hospital for a simple procedure, but I want you to know I'm afraid. I'm afraid to go in because, look, 84 years old, having to use this. I'll be soon in a motorized wheelchair because this thing is getting worse. I'm losing mobility. I have several other comorbid illnesses, and that somebody will look at me and say, do not resuscitate. Well, she's 84, she's lived a good life, let's just let her go. Right? So I've decided when I go in, there is going to be no DNR order. I am going to ask for a full code. And so I see, as I say, in nursing homes, I see the people sitting crying, help me, because they don't have visitors. They have pain and it is not managed. They are lonely. And we are failing them. Hospices and palliative care units, well, I hope they stand by their word to say no, we will not do this. Even if it borders on civil disobedience. Wouldn't it be fun to do civil disobedience? we could all land up in the poker at one time.
I'm doing it. I'm in the process of writing in the college.
And you're doing
politely
it.
explaining why, whatever they say, I will not be doing this.
I will not be doing it.
And I won't be referring, and I won't be raising this as an option.
Yeah, I mean, you don't want to refer. No.
No, if I
You're saying no.
put it on the table to start, so I'm
Yeah.
not in the position of having to hide or.
Well, no, but I think the majority of physicians do not agree. I think well over 70% want nothing to do with this. There's a few, and they've got a lake up now, so you can actually go into it and say, I'm one of the doctors, and another one for nurses. I'm one of the nurses who's interested in doing this.
I can send it in the emails. They send it to everybody.
Yeah, that's out there. It's out there in the public. Anyway, thoughts on the current situation. I think inflicting death on a human being, whether they're in the womb or nearing the end of life, I call it the ultimate act of violence. And I really believe that. As a 16-year-old, I was working at Hotel Dieu in Windsor, up in the operating room, believe me, like cleaning instruments and so on. But it was a summer job, it was great. But I happened to see the result of an abortion. And my heart went down to my boots. I've never forgotten that. And then, you know, when my first child was born, he was born with a very complicated spina bifida. He died when he was only 2.5 months old. But that baby, they wanted me to leave him in hospital near an infected nursery so he would die more quickly. Can you imagine my reaction to that? I said, you either put that baby in my arms and I take him home, or I will have a uniform on and I will haunt you right here. I will not leave. So he came home, and he died at home. And that precious baby taught me my life's work. He taught me what we need in care of the vulnerable, in the grief of a mother, in the grief of a father, in the grief of a family who shared. And that's what taught me palliative care. He would have been 60 years old this summer. I have never forgotten a moment of his baby essence and being.
What is his name?
Thomas Andrew Echlin. Precious little soul. And to me, he spoke right from the heart of God. And I've always listened. Now, to look at, I say, how dare we ask our doctors and our nurses to kill us? I've said this in the newspaper, and I've said it wherever I can. How dare we? And they will not enjoy the same level of trust when this starts. And there's always fear in long-term and acute care anyway. The other thing I just want to mention here is that what's going to happen to the people who are doing this? Will they actually have post-traumatic stress disorder? Will they have, like some of the doctors from Belgium and the Netherlands are saying now, I wish I had never done it. Nightmares are occurring. The feeling, I caused death. So there's a large group who have spiritual dissonance. How can I kill when I can't think of anything that's more clearly said, folks, than God's word, do not kill. And that doesn't apply only to the Christian faith. The Muslim Quran says, you shall not kill. I can even quote one of my Muslim friends taught me, 17:3. I thought, well, I got to, at least if somebody was going to shoot me, I could quote that. Then the other faiths, the major faiths in the world, do not agree with killing people. So, except in the event of war. Is that mine? Oh, how long have I got? Where am I, Kathy? How much?
15 minutes.
You're good.
For total time.
For total time, oh my goodness.
Who's questions?
Okay, look at the people who are going to be abused or have the high potential. the elderly, people with physical and mental disabilities. I tell you, they're frightened. The Council of Canadians with Disabilities has spoken out loud and clear, don't do this to us. Patients with chronic and life-threatening disease, people involved in domestic violence, and I'll say over and over again, this gives the person who has the power balance, and it can be husband or wife or boyfriend or whatever, whoever has the balance of power can easily say, oh, poor dear, she was so depressed. I just had to help her take those pills. Can you hear it?
Yeah.
It's there. That's something I have seen in my lifetime and been horrified by. Persons with depression, and depression, even in late stage disease, can be helped. So, but they're very at risk. Anybody with psychiatric mental health issues, persons suffering with suicidal ideations, and we're saying to them, well, that's nice, we've got a way for you. And so I think, oh yeah, this was one of my ideas. A little bit over the wall, but take this whole thing, MAID, whatever you want to call it, out of healthcare and fund death management. It's death management, it's not healthcare. It's nothing to do with health. You're killing somebody, it's not their health. So take it out, provide a group of professionals called euthananologists, specifically educated and regulated for death care. And any doctor or nurse who can't wait to do this, there's their opportunity. They can become euthananologists. That would have to be, very strictly regulated. Disallow euthanasia in all institutional settings. Have judicial oversight to protect the vulnerable. And like they do in the Netherlands, have mobile units for home deaths. And such places as a clinic, or what I succinctly called a euthanatorium. It could be a nice little home somewhere in the community, right beside the funeral home. So what type of ethical and theoretical frameworks will guide the teaching? What do we use for teaching? Policies, procedures in hospitals. What are we going to use? How will families be integrated into this healthcare plan? What role will economics play? And I'm glad you've raised that, because I think economics is driving this whole thing. And I can say it because I don't have to go to jail right now. I still have my licensure to practice nursing, and other than my mouth, they can't get me on anything. So there we are. My recommendations, just funding and support from the federal, provincial governments for hospice palliative care to ensure excellence of care, and for every Canadian, teaching it in every medical and nursing school, the fundamentals, educate the current healthcare providers, and redefine terminal. I think we've got to make that much shorter. As abortion has been manipulated to include sex selection now, give me a break. I'm so glad I didn't know who was coming. I didn't. I felt the boys were a little bouncier. My lovely daughter was a little more gentle in womb. And so I kind of called them by name and sang to them before they were born. But they were there. And I didn't know who they were. It was lovely. And so I see the same problem coming with MAID. The one committee suggested that within 3 years we should have euthanasia for the mature minor. Like, come on. I was not mature when I was 15, 14, 12. And in the Netherlands, they have the Groningen protocol for babies up to age 12, if the parent wants that.
Guys aren't mature until they're 25.
liners are this is ridiculous. So Canada is becoming known as the culture supporting death by lethal injection or assisted with suicide. If you don't get the rest of it, don't worry about it, because we as a group, as people, as individuals, as groups, must keep the struggle. We must keep on struggling to prevent, to dissuade people from doing this. And we must continue the struggle at every level. And I don't know how we're going to track the numbers, because I have a feeling there's going to be a lot of lying. The Netherlands, 1,000 people were killed in Belgium in 2013 without their consent. This is not okay. The upshot is nobody's going to keep a good record. And Etienne Barret, again in Quebec, is saying to the doctors, don't chart that you've euthanized somebody, chart that you have the underlying disease is what killed them. Anyway, folks, it's been an honor and a privilege to be here with you.
Who said that a presentation on assisted suicide couldn't be full of wit?